What are the early symptoms of pregnancy? Episode 2. Number 10. Morning sickness, nausea, and vomiting during early pregnancy. Nausea and morning sickness usually develop around weeks 4 to 6 and peak around week 9. Although it's called morning sickness, it can occur anytime during the day or night. It's unclear exactly what causes nausea and morning sickness, but hormones may play a role. During the first trimester of pregnancy, many women experience mild to severe morning sickness. It may become more intense toward the end of the first trimester, but often becomes less severe as you enter the second trimester. Tips: keep a package of saltine crackers by your bed and eat a few before you get up in the morning to help settle morning sickness. Stay hydrated by drinking plenty of water. Call your doctor if you cannot keep fluids or food down. Number 11. High blood pressure and dizziness during early pregnancy. In most cases, high or normal blood pressure will drop in the early stages of pregnancy. This may also cause feelings of dizziness since your blood vessels are dilated. High blood pressure, or hypertension, as a result of pregnancy is more difficult to determine. Almost all cases of hypertension within the first 20 weeks indicate underlying problems. It may develop during early pregnancy, but it may also be present beforehand. A medical professional will take your blood pressure during your first doctor's visit to help establish a baseline for a normal blood pressure reading. Tips: consider switching to pregnancy-friendly exercises, if you haven't already. Learn how to track your blood pressure regularly. Ask your doctor about personal dietary guidelines to help reduce high blood pressure. Drink enough water and snack regularly to help prevent dizziness. Standing up slowly when getting up from a chair may also help. Number 13. Weight gain during early pregnancy. Weight gain becomes more common toward the end of your first trimester. You may find yourself gaining about 1 to 4 pounds in the first few months. Calorie recommendations for early pregnancy won't change much from your usual diet, but they will increase as pregnancy progresses. In the later stages, pregnancy weight often shows up in the breasts, about 1 to 3 pounds, uterus, about 2 pounds, placenta, 1.5 pounds, amniotic fluid, about 2 pounds, increased blood and fluid volume, about 5 to 7 pounds, fat, 6 to 8 pounds. Number 12. Smell sensitivity and food aversions during early pregnancy. Smell sensitivity is a symptom of early pregnancy that's mostly self-reported. There's little scientific evidence about smell sensitivity during the first trimester. However, it might be important, since smell sensitivity may trigger nausea and vomiting. It may also cause strong distaste for certain foods. You may experience either a heightened or lessened sense of smell during pregnancy, according to 2017 research. This is especially common during the first and third trimesters. Heightened smell is more common than lessened smell. Some smells that never bothered you before may become less pleasing or even trigger nausea. The good news is that your sense of smell usually returns to normal after delivery, or within 6 to 12 weeks postpartum. Number 14. Heartburn during early pregnancy. Hormones can cause the valve between your stomach and esophagus to relax. This allows stomach acid to leak, causing heartburn. Tips: prevent pregnancy-related heartburn by eating several small meals a day instead of larger ones. Try to stay sitting upright for at least an hour after eating to help your food digest. If you need antacids, talk with a doctor about what may be safe during your pregnancy. Number 15. Pregnancy glow and acne during early pregnancy. Many people may begin saying you have the pregnancy glow. The combination of increased blood volume and higher hormone levels pushes more blood through your vessels. This causes the body's oil glands to work overtime. The increased activity of your body's oil glands gives your skin a flushed, glossy appearance. On the other hand, you may also develop acne. Number 16. How quickly can I know if I'm pregnant? You can generally know if you're pregnant 1 week after you've missed a period. The Office on Women's Health in the U.S. Department of Health and Human Services says that taking a home pregnancy test at this point will give a more accurate result. Home pregnancy tests are inexpensive and widely available without a prescription in pharmacies and other stores. You can take a test earlier than this if you want, but you run the risk of getting a false negative result. This means the test may say you're not pregnant, but in fact you are. If you take a home pregnancy test too early, there may not be enough HCG in your urine yet for the test to detect it. Home pregnancy tests work by testing the amount of HCG in your urine. This is a hormone that's only present in the blood and urine of pregnant people. Also, every person's body chemistry is a bit different. One person may get a positive result as early as a day after their period, while another person's positive results may not show up for another week. So, early test results may not be the most accurate. Blood tests can often detect HCG earlier in a pregnancy than urine tests. Blood tests can sometimes give a positive result as early as 6 to 8 days after you ovulate, while urine tests do so about 3 weeks after ovulation. Unlike at-home urine tests, blood tests are usually done in a clinical setting. Contact your doctor if you want this type of test. Symptoms of pregnancy like nausea, fatigue, and breast tenderness sometimes occur even before you miss a period. These symptoms may give you an idea that you're pregnant, but they are not sure proof. Only a test will tell for sure. Tips. The Office on Women's Health advises that if you get a negative result on a home pregnancy test, take another test a week later to recheck. Some home pregnancy tests are more accurate than others. Here is a list of the best home pregnancy tests. Be sure to pick one that is known to be accurate. Number 17. When should I take a pregnancy test? If you think you might be pregnant, the best time to take a home pregnancy test is 1 week after you first miss a period. According to the National Institute of Child Health and Human Development in 2017, home pregnancy tests are 97% accurate when used properly at the right time. A blood test can often reveal a pregnancy much earlier, but it must be done at a doctor's office or in a clinical setting. Number 18. When should I call my doctor? If you get a positive result on a home pregnancy test, you should call your doctor right away, according to the Office on Women's Health. The doctor can prescribe a more sensitive test and perform a pelvic exam to tell for certain if you're pregnant. To keep you and the fetus healthy, the Office on Women's Health recommends you see a medical professional as early as possible in your pregnancy. You can then schedule regular prenatal visits throughout your pregnancy. Number 19. Takeaway. Your body will go through significant changes in early pregnancy. You may see signs such as nausea, breast tenderness, and, of course, the hallmark symptom of a missed period. If you think you might be pregnant, A good first step is to take a home pregnancy test. These tests are widely available without a prescription in pharmacies and other stores. If you receive a positive result, call a doctor for an appointment. They will perform an examination and a further test to confirm your pregnancy. You can then get started on a prenatal program to safeguard the health of you and the fetus.